So within this intervention, within this approach we're employing here, the care manager is very much situated. It's very much central to the implementation. So Dagmar, could you give us a few words about who are the care managers and maybe a little bit about what their day-to-day looks like in this approach?
Our care managers in the ESCAPE project are actually people who have some background in healthcare provision. So many of them are nurses, some are psychologists, with a bachelor degree. So they have some background of healthcare, and they discuss with the patients what their basic health goals are. So what would they like to achieve? So there's many patients having problems, for example, with mobility. Most of them in this very first talk say they would like to be more mobile, they would like to be more autonomous, do their own things, steering their lives. And in this first contact, they also clarify to what degree carers should be involved. Is there an informal carers in the household who can support, who can do things, or who can even be present in the talks? Okay, so care management process starts. And that involves, on average, telephone calls with the patients and the care manager, discussing how could the goals be achieved, where are problems, are there information needs that need to be covered, maybe other goals to be set, are there symptoms that are worrisome that should be cured, and that is more or less the process going along over the 9 months. And in regular intervals, the progress of the patient is actually explained to the specialty team. And if there are problems where the specialty team can help with advice from different medical specialties, these will, via the care manager or via the GP, be brought to the patient.
Yeah, just also wanted to point out that the healthcare systems in Europe are very complex, and the digitalization of the treatment is changing them in a tremendous way. And especially elderly persons, multimorbid persons, they need a trustworthy support in these complex systems to navigate there. And therefore, the patient pathways have to be clarified. And we also need layman understandable information, especially barrier-free information. And therefore, it is important to have a bundle of measures to have an intervention to fulfill all these supporting tasks. And therefore, I think the ESCAPE project is very important for the patients in the future in the healthcare systems in Europe.